If you're turning 65 in 2026 and you don't understand Medicare before you enroll, you could lock yourself into a situation that you may not be able to change, which could come with late enrollment penalties or unexpected out-of-pocket costs. Medicare is not a single one-size-fits-all plan. It's made up of different parts that come from the government and private insurance companies. These parts come with enrollment windows, potential enrollment penalties. Oftentimes people make this choice one time. These are plans they haven't dealt with before. So understanding what happens when you turn 65 is extremely important because you don't want to get stuck with any enrollment penalties that could be permanent or unexpected out-of-pocket exposure. So let's get into how Original Medicare works. So we're going to go through the different parts of Original Medicare, what comes from the government, what comes from private insurance companies. Okay, so touching on this Medicare 101, let's talk about the different parts to Medicare, right? So what comes from the government, you have Original Medicare Parts A, Parts B, and the drug coverage. Now, the prescription coverage itself doesn't necessarily come from the government. The government will set the standard model, which the private insurance companies kind of have to abide by when offering Part D plans, which we will touch on as well. So Part A, what is Part A? So Part A is hospital coverage. So this covers inpatient care, skilled nursing, hospice, and home health care. Most people will qualify for Part A without a premium based on their work history. So that is essentially you've paid into Social Security or Medicare tax for 10 years or 40 quarters. Once there's other standards too, where you do have to pay a premium, like premium is different if you're between 0 and 32 quarters, and then 32 to 39 quarters, you could have a premium for Part A. But again, most people are going to have a premium-free Part A. Okay, so Part A, inpatient care, right? And then, so people that are eligible for Part A, again, folks that are turning 65, or if they have health conditions, right? So like Lou Gehrig's disease or end-stage renal disease, you can get Part A before you turn 65, or if you're on SSDI. So if somebody's on Social Security disability for 2 years, you could also qualify for Original Medicare, which includes Part A and B. So again, often there's no cost for Part A, right? And the Part A will work with any hospital system that accepts Medicare across the country, which again, most hospital systems are going to accept Medicare. So Part A, the way that it's set up, the way that it works, you have a Part A deductible. So this is a per admission deductible. So each time somebody would go into the hospital, you'd pay $1,718. Okay, so again, that's if you leave the hospital and you come back 60 days, a benefit period is defined as 60 days apart. So it's a per admission deductible. You're an inpatient, you go into the hospital, you come out, you have to go back 90 days later, you're going to have that deductible again. Okay, so there's a per day copay once you reach that deductible. So days 1 through 60, again, you have that Part A deductible. Once you've accumulated 60 days of inpatient care, days 61 through 90, you're going to have a per day deductible that's $434. And then once you get to the days 90 through 150, you have a copay of $838 each day. And again, that's just important to remember, this is with Original Medicare. Oftentimes people can get secondary plans that'll help to, kind of fill in the gaps or greatly reduce or eliminate that exposure as well. Okay, so the other service that Part A covers is skilled nursing. So skilled nursing would be like a rehabilitation center. So if somebody's an inpatient for 3 days in the hospital, right? And then they leave the hospital, they transition to a skilled nursing center. The first 20 days, you don't pay anything. Days 21 through 100, you have a $217 per day copay. And then days 101 and beyond, again, there's no coverage for that because Medicare will cover 100 days of skilled nursing per benefit period. Okay, so Part B. So Part A, you can kind of think of that as like the inpatient care, hospice, skilled nursing. The Part B are doctor visits, physician services, and outpatient care. So we'll kind of get into how Part B works here too. Now, the Part B, you do have a standard premium, whereas Part A, if you've paid into Medicare tax for 10 years or 40 quarters, you're not going to have a monthly premium. The standard premium in 2026 for Part B is $202.90. Now, sometimes people could pay more based on what their income was. That's what they call IRMA, income related monthly adjustment amount. That's based off what your income was 2 years prior from when your effective date is, and that's your adjusted gross income, or they use a formula called modified adjusted gross income, which we'll get into. There is a penalty if you do not sign up when you're first eligible, unless you have other credible coverage, like an employer group plan. Then again, that would be deemed credible coverage and you would not have a late enrollment penalty. A lot of times we'll get calls from people and they'll say, well, I was told I have to sign up even though I have coverage to work, or I could face a penalty. That's not always the case. Well, it's mostly not the case, right? Unless the employer has less than 20 employees. And in that situation, you would have to sign up for Part B because original Medicare would be primary payer. If the employer has over 20 employees, then Medicare would be secondary, so you don't have to sign up for Part B in that situation, or Part A for that matter. Okay, so again, this IRMA, right, the income-related adjustment amount, this is kind of the bracket, if you will, so where you don't have a premium for Part B, you can see if you're a single person, you're making under $109,000, or if you're married, you file jointly. If you're under 218, you just pay the standard rate, right? We'll get into the Part D coverage, but there's a surcharge for the Part D too, based on your income as well. But so you can see the most somebody's going to have to pay is $689 based on their income for Part B. Okay, so the way that the coverage works overall, so let's say you just have original Medicare, right? Parts A and B. You go to the doctor. You're not going to pay anything right then and there at the doctor's office. The doctor is going to submit the claim to Medicare. Medicare is then going to send, the doctor, okay, well, this is our Medicare approved rate for this service. Then me as the insured person, I would get a bill for that Medicare negotiated rate, which, if it's a Medicare bills on different levels of complexity. So, it might be $80 or $100, $120 if you go to the doctor as you're paying towards this Part B deductible. So this Part B deductible is $283, right? So once I satisfy that $283 deductible based on a calendar year, then Medicare is going to pay 80% and I'm going to pay 20% once I exceed that deductible. Okay, what this means is Medicare assignment excess charges. So this is if a doctor doesn't accept payment from Medicare, which is it's pretty rare. I think the statistic is 98% of doctors were accepting assignment from Medicare. And then there's also 8 states where they can't bill this excess charge. They have this Medicare overcharge measure law. So, but let's say you were in a state where they could bill it and it's a doctor that doesn't take assignment. They can only bill in excess of 15% above Medicare assignment. So that's what an excess charge is. So let's say a doctor is allowed to bill $100 in Medicare, they could bill $115. And then you would be responsible for that excess in that rare circumstance where it could be billed. Okay, whoops, excuse me. So Part D. Okay, Part D, prescription drug coverage. So again, Medicare sets a standard model for prescription drug coverage, but they don't necessarily offer prescription plans. These come from private insurance companies, okay? You have to have A or B to get a drug plan, okay? And plans often have their own formularies, premiums, deductibles. The standard Medicare Part D deductible is $615, which we'll discuss. Now, the private insurance company that offers the drug plans, they can choose to offer a lower deductible, different formularies, etc. Okay, so those are the parts to original Medicare, right? Now, where the backup plans come in, right? There's two different types of plans that you can get with original Medicare that we'll discuss. So one is Medicare Supplement, the other is Medicare Advantage, or sometimes you hear that referred to as Part C. So I'll explain how they work here. Some dates that you should pay attention to when you're first becoming eligible for Medicare, these initial enrollment dates, 3 months before your birthday. So that's before you turn 65, you can apply for original Medicare, right? So if your birthday is in the middle of the month, the effective date is going to be the first of the month in most cases. Okay, so you have 7 months, 3 months before your birthday month, and then 3 months after to enroll in original Medicare, as well as you get a Part C plan, Part D. And the Medicare supplement enrollment window is a little bit different, which we'll talk about. Okay, the annual dates. So one thing is we discussed the different types of Medicare plans, right? Medicare Supplement, Medicare Advantage. Oftentimes people get confused by the annual election period. So the annual election period is for Medicare Advantage and Part D plans. It's not, Medicare supplemental plans do not have an annual election period because technically you can apply for a Medicare supplement plan any time of the year. You just have to qualify based on medical underwriting, which we'll discuss. So there's this general enrollment period, right? This is if you didn't get original Medicare when you first became eligible. You could then apply here January 1st through March 31st each year during that general enrollment period for original Medicare. There's also this Medicare Advantage open enrollment, right? So during this period of time, January 1st through March 31st, you can change from one Medicare Advantage plan to another Medicare Advantage plan, and then your AEP again. As we discuss, you can change your drug plan, Medicare Advantage plan, switch to original Medicare. But again, it's important to note that during the annual election period, this doesn't really apply to Medicare supplements because, again, to change your plan, you have to get underwritten for a Medicare supplement unless you're in your initial enrollment window. Because when your initial enrollment window, when you're first eligible for Medicare, you do not have to get underwritten for a Medicare supplemental plan. Okay. So going forward, those were the election dates. Now we'll talk about the plans themselves. So when you get a Medicare supplemental plan, it's important to note that original Medicare is the primary payer, right? So you go to the doctor, you would give the doctor your Medicare card, and you would give them your secondary insurance card. And when that's the case, as long as the doctor takes original Medicare, you don't have to worry about, well, does my doctor take the supplement? Because sometimes people say, well, I have to see if my doctor takes Blue Cross or Aetna or Humana. But that's not the case for the Medicare supplement. Okay. The supplemental plans are all standardized. As long as the doctor takes original Medicare, he's going to take the secondary plan because the secondary plan pays off the Medicare approved schedule. Okay. So you just have to have A and B to get a Medicare supplemental plan. Okay. You're going to pay a premium for your Medigap policy as well. Typically, when you're comparing a supplement to Advantage, which we'll talk about, the supplement, you have higher monthly premiums and then lower out-of-pocket costs as you use the plans. Okay. So this guaranteed coverage, I mean, that's like I said before, when you're, first eligible for Medicare, you don't have to answer any health questions when applying for a Medicare supplemental plan. Okay. So you have a choice of doctors and hospitals. You can go to any doctor, any hospital in the country that accepts Medicare. All the Medicare plans are standardized. So they all have these letters, right? So Plan N or Plan G, it's the exact same coverage when you're looking at different insurance companies. Every company's Plan G is the same. Every company's Plan N is the same. Okay, the premiums may be different, which we can discuss when comparing. We could talk about that. Okay, so then Medicare supplemental plans, again, we just discussed these. They have this standardized letter set. The core Plan A, that just means every carrier has to offer Plan A. Sometimes they'll have these extra coverage options, which will include like foreign emergency travel, which a lot of plans will cover up to, some of the standardized plans will cover up to like $50,000 of foreign travel. They may cover some of these deductibles, like the Part A deductible, the skilled nursing copays as well. Okay, so this Plan C and F, these are like older plans. So for people who became Medicare eligible before January 1st, 2020, they could get these other plans like F and C. Those were plans, well, F in particular had no deductible, no Part B deductible. So that's no longer an option for folks that are turning 65. Going forward, you can still get this plan called Plan G, which is, you could say, is most similar to F, just that it does still have the Part B deductible as well. Okay, so some states they'll have their own state-specific plan designs, like Minnesota, Wisconsin are two states that work like that. But for the most part, most of the plans follow that kind of national model that we discussed there. So the Advantage plans. So with a supplement, it doesn't include the drug coverage, right? So when you get a Medicare supplement, you have original Medicare, a Medigap or Medicare supplemental plan, and a separate drug plan if you wanted drug coverage. And then often, if you wanted dental and vision, those two would be separate plans. So when you get an Advantage plans, what happens is the insurance company will often include all of those plan options in one, right? And the insurance company will take over from Medicare as the primary payer. So before, when we were discussing the supplement, it's important to note with a supplement, original Medicare is the primary payer. So you go to the doctor, you give the doctor your Medicare card and your secondary insurance card. When you have a Medicare Advantage plan, it kind of works like a plan that you would have had through the employer, where you go to the doctor, you give the doctor the insurance company's card. Okay. And that card will include like the medical, oftentimes the prescription, and other services like dental and vision. So you have one card that you're kind of using everywhere. Some of these plans may or may not have a premium, but you are paying for Part B. Regardless, you have to have A and B to enroll in the Medicare Advantage plan. There's different types of these plans, like there's HMOs, PPOs, like you would traditionally see in an individual plan or employer group plan structure. So obviously with both HMOs and PPOs, you have a network. The PPO is going to have out-of-network benefits, whereas the HMO is not. One thing that you'll see with these Advantage plans, though, is that you're going to be covered as if you're in network for emergent needed care, which is oftentimes, emergency rooms, hospital stays on an emergency basis. There are special plan options for folks that are also enrolled in Medicaid. So that's what they call dual eligible. Chronic special needs plans are for folks that have a chronic health condition, such as diabetes or a cardiovascular condition. There's also special plan options. Medicare Advantage plans will often have these extra benefits, right? Like you'll see like silver sneakers, gym benefits, dental, vision, hearing, transportation as well. So that's another distinction here. So remember, original Medicare, Medicare supplement, I get a separate drug plan. Okay. So right there, I have three cards. I have my original Medicare card, my supplemental card, and my prescription drug card. With Medicare Advantage, the insurance company is taking over from Medicare as the primary payer. They're often going to include the dental and vision and the prescription coverage in one plan. So these typically Advantage plans are less expensive. Sometimes you see those even advertised for zero premium. And people will say, well, how can it be zero premium? And what's happening when they're taking over as primary payer from original Medicare, they work on this reimbursement model based on an enrollment basis. So the government sets a standard reimbursement per year. And, they're getting like this annual stipend based on their enrollment number. So that's how they can offer those plans at no cost. Because again, they're taking over the billing, they're doing prior authorizations, claims processing from original Medicare, right? So original Medicare, you still have to be enrolled, but they're no longer in the picture when it comes to claims. Okay, so that's an important distinction as well. So the prescription drug coverage. Now the prescription drug coverage, again, this could be standalone with a Medicare supplemental plan, or it could be part of your Medicare Advantage plan. Okay, so there's usually a premium for the Part D there's this annual deductible of $615. The individual plans, they can choose to lower that deductible if they want. Like sometimes you'll see a higher premium. The plan may have a $280 deductible, or you may see on Advantage plans no deductible on the prescription portion of the coverage. Tiers 1 and 2, oftentimes you'll see a 5-tier formulary. Tiers 1 or 2 may be like lower cost generics. Oftentimes you may have a copay waived for those lower tiers. Okay. And then the formulary, again, every plan, they have to have at least two therapeutic equivalents of every FDA approved drug. So there's usually something similar on a formulary that you can have access to. If you take a specific drug that the plan does not cover or is not on any Part D formularies, which does happen, the doctor can write a formulary exception to the plan to get Medicare to cover the prescription as well. So all is not lost if you see that no plan covers your drugs. There's other mechanisms or means to get that drug coverage as well. So there is a late enrollment penalty if you do not enroll in a Part D plan when you first become eligible, unless you have other coverage. And that late enrollment penalty usually averages out to be like $4 a month for every 12 months that you don't have it, right? There's a standard percentage based on the average cost of a prescription drug plan. Is kind of how they formulate that. So again, there's tiers for these plans. Step therapy is like, okay, well, we want you to try this other drug before we'll approve this drug. Prior authorization and quantity limits. Again, a lot of times the doctor will have to send in a prior auth on these Part D plans as well. So there used to be a coverage gap that has kind of gone away, or this donut hole. That's kind of a popular term. There's an out-of-pocket limit on drug costs now. So going forward in 2026, the out-of-pocket limit is $2,100. Okay. Plans have what's called a Medicare prescription payment plan. The way this Medicare prescription payment plan works is you can contact the insurance carrier offering the plan and enroll in this payment plan to spread out your out-of-pocket drug exposure over the course of the year instead of paying a higher amount up front. So essentially you're paying that prescription cost to the insurance company as opposed to paying it at the pharmacy when you go to pick up the prescriptions. Okay, so that's kind of how the Part D works. Now, the Part D, again, it can be part of a Medicare Advantage plan, or it could be a standalone Part D plan if you have a Medicare supplement. So how are we comparing the plans? How do you compare the plans? Well, when you're looking at the different options, again, Medicare supplement, you could say, well, I'm going to pay more every month. And then, typically you might see like plans ranging from $150 to $200. I'm going to pay more every month, and then I'm going to pay less. Obviously, when something happens, maybe I just have that Part V deductible of $283, right? The Advantage plans, you're going to pay less every month. So sometimes you'll, again, pay $0. And then you'll have copays as you go. Maybe you have a copay at a specialist that's $40. Maybe you pay $200 for an MRI. So you're kind of paying as you go along, right? Sometimes you'll hear people say, well, don't get an Advantage plan or only do a supplemental plan. Well, a lot of when you hear this kind of secondhand knowledge, it's getting distorted as it passes through different people. A lot of it pertains to your area, right? So if you're in an area where the Advantage plans have a really great network and a great health system, and it's an area where people kind of travel to across the country to seek care, it may be a good choice, right? Sometimes people say, well, I'd stay local if something happened. If I did get cancer or if I did have a major illness, because we have a great health system in the area. And I'd rather save the money every month because I know over time, the savings is going to be much more than than what I would have paid out of pocket, right? Even if I had an out of pocket maximum. And then other times folks will say, well, listen, I want to go to any doctor I feel could treat me the best, no matter where they're located, whether that's MD Anderson in Texas, Sun Kettering, New York. And I want that peace of mind, right? And I want to pay more for that peace of mind with the Medicare supplement. That's fine too. So a lot of times it is kind of personal preference, right? There's not really necessarily one size fits all solution, right? But just some things to note, right? When you're looking at the different ones, if it's an Advantage plan, again, you do have a network. You have to make sure that your doctors take the plan, right? So like if it's like a Blue Cross plan or a Aetna plan, you go to the doctor, you're going to give them that card because the Advantage plan is primary payer. So you have to be in network. What is the out-of-pocket limit, right? All these plans have an out-of-pocket maximum that pertains to the health portion of the coverage. There's a separate prescription drug out-of-pocket maximum. So again, that's important to keep in mind. Okay, a lot of these Advantage plans have those popular added benefits, dental, vision, gym membership benefits, right? And then when you're looking at the Medicare supplements and you're comparing carriers, one carrier to another, like one company has Plan G, another company has Plan G. Why is the price different? Well, there's a number of reasons, but a lot of times you'll see new companies come into the market and they'll have the lowest price, right? You don't always want to choose a plan based on lowest price, because why are they offering the lowest price? Well, they want to increase their membership. They want to get enrollment numbers up. And as soon as they hit their enrollment target, what are they going to do in subsequent years when they don't have a large base to spread the risk across? They're going to raise the price, right? So when you're choosing a Medicare supplemental plan, you want to look at, okay, how long has the carrier been in the market? How many folks are enrolled in the plan? You want a stable carrier that has a lot of people to spread the risk across. Those plans tend to be more stable, right? So again, the supplements, they have gone up. They're going to go up every year. There's no way to avoid that. But if you are choosing a supplemental plan, you do want to choose a carrier that has shown a track record of being more stable than some of these newer carriers or carriers that have only been in the market for a year. So those are some important distinctions to keep in mind. Okay, so again, Medicare, we have another video on Medicare right here, how to check out different plans, how to compare plans, how to make sure that you're not going to have any unexpected out-of-pocket exposure or potentially late enrollment penalties. So here's another one to check out. We thank you guys for continuing to join us.